a good example is, I think, Alzheimer's disease, and in particular, the non-familial sporadic Alzheimer's, which is the most common form of Alzheimer's. And the focus has been on the occurrence of plaques and tangles in the brain. And the idea is the plaques and tangles are there in all Alzheimer's patients, so they must be causing the Alzheimer's, without thinking, well, maybe they could be a consequence. And also without sort of forgetting that we define Alzheimer's as a dementia that has plaques and tangles, right? So there's a circularity there. But, when you look at it closely, it really looks like for example, the plaques, the amyloid plaques, are involved in some pretty complicated interactions. The first question is, why would the body have amyloid plaques just forming and causing the brain to malfunction, right? And one of the arguments is, well, that's a disease of old age, and we're not very well adapted to have things work in old age, decades of old age. So that's one explanation. That there are holes in that explanation. For one is that this occurs even in younger ages, where we expect natural selection to have sort of solved the problem. But then as data become more apparent, then you begin to see that there are problems with that explanation. One problem is when you actually have interventions that target the plaques, it looks like they have, at least some of them have some positive effects, but most of them don't. And so the question is, why is it with all this effort and dozens of studies that target this, only a few seem to provide a benefit, and the benefits are really quite minor? So that's an issue that has to be addressed. Part of the resolution is these amyloid plaques are formed as a result of the accumulation of the beta amyloid fragments of bigger protein. And those fragments, although they do have some toxic effects, which probably contribute to Alzheimer's, they're also antimicrobial. And so when you actually look at all of the data, what emerges is that these microbes, in this case, bacteria largely, but some viruses, look like they're very strongly associated with Alzheimer's. They're causing damage that is correlated with the genetic associations with Alzheimer's, and they're triggering amyloid beta protein formation. And the way to think of that is the brain may detect a pathogen in it, a virus or a bacteria, and it starts producing beta amyloid as an antimicrobial. And so there can be a battle that's on, and the amyloid beta is produced, and it ends up forming plaques. And those plaques can cause damage, but a lot of the damage may be the damage associated with this battle that's going on between the pathogens that have gotten in the brain and the beta amyloid. And so, one of these pathogens, actually two of the pathogens that really look like they're commonly found in Alzheimer's and maybe causal, are pathogens that are causing gum disease and periodontitis. And so that's sort of an odd thing. Why would that be the case? But these pathogens tend to be very invasive. They get into the bloodstream, and they actually are causing damage in a lot of places in the body, but one place seems to be in the brain. So then you look at these associations, and you do studies with mice, and you can show that these pathogens can be generating molecules that are sort of damaging the brain, but then also the production of the amyloid is helping to control those damaging chemicals. So you begin to see in a mechanistic way how this can actually work together. So you sort of put it all together and say, well, the arguments about Alzheimer's just being the body falling apart aren't very compelling. And when you look at the genetic associations, yeah, they look like they're contributing, but they're not actually explaining all of Alzheimer's or even most of Alzheimer's. And so then you ask, well, what are the genetic vulnerabilities? One of them is this epsilon 4 protein. And the epsilon 4 protein looks like it's interacting with some of these pathogens that are showing up in Alzheimer's. So the pathogens may be more able to cause damage, or we're more vulnerable to the pathogens if we happen to have this genetic basis. Okay, and so there are all of these kinds of factors. And if you look at the interaction between these organisms that are causing gingivitis and periodontitis, then you also have social factors. And one important aspect of this is how well are people take care of their teeth, or especially are they flossing? And there's information suggesting it's correlative, but there should be experimental information coming out soon, indicating that if you floss, you really lower your risk of Alzheimer's. And that's pretty surprising, right? But it's actually very encouraging. If you floss, you also control your periodontal disease. And so if you're controlling your periodontal disease, it may mean that you're going to have less of that invasion in the body and less of the damage to the brain. And then the other question is, well, why are some people motivated to have better oral hygiene? Or why are they having better hygiene regardless of motivation? So some of that's education, some of it's access to good dental care, and some of it's diet too. So we've got all of these things interacting. And if you look at any one of them, it doesn't explain it. But if you look at how these things interact together, the genetics, the environment, including the social environment, and also microbes, then you begin to see a picture emerging, which really at least provides a coherent view. But then we have to say, well, is this coherent view really the right answer or not? Then we have to try to test those interactions. And that's hard to do, but we have to at least recognize that those are the hypotheses, sort of complex hypotheses that are consistent with the evidence that we see.